Stroke overnight? Yes, you heard that right. This shocking fact could change your perspective on supplements often considered safe. Surprisingly, there's one vitamin that can suddenly trigger a stroke, and you might not have realized it. Even brain specialists warn us about the hidden dangers of this vitamin, which could threaten your life within hours. Are you ready to find out? Don't miss this video because it could save your life. Hey everyone, welcome to the very first video on After 50 Plus. We're so excited to have you here as we kick off this journey together. If you're looking for expert insights, tips, and the latest updates on health and wellness, you've come to the right place. Don't forget to hit that subscribe button and ring the notification bell so you never miss any of the valuable content we'll be sharing. Let's dive right into today's topic. What is a stroke and why can vitamins trigger it? Have you ever imagined a stroke happening overnight? This might sound like an unbelievable story, but in reality, a stroke can strike suddenly, even without warning. However, what's more surprising is that some vitamins we consume with the intention of staying healthy can become triggers for a sudden stroke. Vitamins we often consider safe can be dangerous, and this is often overlooked by many. A stroke occurs when blood flow to the brain is blocked, which can be caused by two main things: a blood clot blocking a blood vessel, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. Both conditions cause the brain to not get enough oxygen, which can eventually lead to permanent brain damage. It turns out that a stroke can be triggered by consuming certain vitamins we consider ordinary. One vitamin that is very important for our body, but can also be dangerous in excessive amounts, is vitamin K. Vitamin K helps with the blood clotting process, which is crucial when we get injured. However, if we consume vitamin K in excessive amounts, it can lead to uncontrolled blood clotting. This can eventually cause blood clots that block blood flow to the brain, triggering an ischemic stroke. Vitamin K becomes very dangerous for people who are already taking blood thinners or have blood clotting issues, as it can worsen their condition and accelerate the risk of stroke. Then there's vitamin E, known as a powerful antioxidant for our heart and skin. This vitamin is beneficial in fighting free radicals and protecting the body from damage. However, excessive consumption of vitamin E can worsen the blood clotting process. If too much is consumed, vitamin E can lead to abnormal blood clotting, which results in a decreased ability of blood to clot. This can cause a hemorrhagic stroke, which is caused by bleeding in the brain. Vitamin E is indeed good for health, but in excessive doses, it can pose a significant danger, such as bleeding that can permanently damage brain tissue. But the problem doesn't stop there. There's also vitamin D, which, although known for maintaining bone health and strengthening the immune system, can also cause serious problems if consumed in excessive amounts. Vitamin D helps increase calcium absorption in the body, which is beneficial for bone health. However, excess vitamin D can lead to calcium buildup in blood vessels, which eventually causes calcification of blood vessels. This condition leads to increased blood pressure, a major risk factor for stroke. So, while vitamin D is excellent for bones, too much of it can cause significant problems for the circulatory system, leading to a sudden stroke. Many people don't realize that a vitamin overdose can backfire on their health. When we consume supplements or vitamins without medical supervision, we can fall into the assumption that more vitamins mean better health. But in reality, excessive vitamins in our body can pose a very high risk, especially for those who already have heart problems, high blood pressure, or blood clotting disorders. Vitamins, which are supposed to support body health, can turn into very dangerous weapons when consumed in excessive amounts. Not only that, but we often assume that vitamin supplementation is safe without paying attention to the correct dosage or side effects. In fact, consuming too many vitamins can be a danger sign that worsens our body's condition and increases the risk of stroke or other serious diseases. It's important to understand that not all supplements or vitamins are suitable for everyone, especially if we have certain medical conditions. Before consuming any vitamins or supplements, always consult a doctor or nutritionist. This is a crucial step to ensure we get the maximum benefits from the supplements we consume without adding dangerous risks to our bodies. When it comes to health, a cautious approach is best. Don't consume supplements haphazardly without understanding their impact. If you have a history of heart disease, diabetes, or blood clotting problems, make sure you get regular checkups and consult with a medical professional before deciding to take certain supplements or vitamins. This way, you can keep your body healthy without facing unnecessary risks. Vitamin D, a hidden danger that can trigger stroke. Vitamin D may be very familiar to us, especially for those who want to maintain bone health or strengthen their immune system. We often hear that vitamin D is one of the important vitamins that must be consumed to keep the body healthy, especially as we reach 40 or 50 years old. But did you know that excessive vitamin D can cause major problems leading to a sudden stroke? Yes, too much vitamin D can increase the risk of stroke, and this is often overlooked by many. Why is that? Vitamin D is known for its ability to increase calcium absorption in our bodies. This is a very important process because calcium is not only needed for strong bones, but also for muscle function and heart health. Vitamin D helps maintain balanced calcium levels in the blood, which is crucial for our overall health. However, excessive consumption of vitamin D can lead to calcium buildup in the blood and cause calcification of blood vessels, which affects our circulatory system. Vascular calcification is a process where calcium builds up in blood vessels, making them stiffer and less flexible. This will worsen the condition of arteries, large blood vessels that carry blood from the heart to the rest of the body, increasing blood pressure and putting extra strain on the heart. As a result, this increase in blood pressure and decrease in blood vessel elasticity can increase the risk of stroke, heart attack, and even heart failure. This is one of the main risk factors for stroke that many people often do not realize. Excessive vitamin D not only risks causing calcium buildup in blood vessels, but can also lead to increased calcium levels in other organs, such as the kidneys and heart. Calcium buildup in the kidneys can lead to kidney stones, which in turn can cause kidney failure if not treated immediately. If calcium deposits in the heart, it can cause cardiac arrhythmias or irregular heartbeats, which increase the risk of heart attack or stroke. However, vitamin D is not just about calcium buildup. Excess vitamin D can also lead to an increase in calcitriol hormone levels, which regulates calcium balance in the body. When calcitriol levels increase, it draws more calcium into the blood, which worsens calcium buildup in blood vessels and increases the potential for blood clots, which can block blood flow and trigger an ischemic stroke. What's even more frightening is that high concentrations of vitamin D can worsen the condition of people who already have heart or blood vessel problems. For those who already suffer from hypertension, high blood pressure, or coronary heart disease, consuming excessive vitamin D will only exacerbate their condition. This becomes very dangerous because it can trigger a heart attack or stroke without prior warning. Now, you must be asking, how much vitamin D should we consume? This is a very important question because while vitamin D is beneficial, excessive consumption can be very dangerous. The safe limit for vitamin D consumption, according to health experts, is around 4,000 IU per day. However, many people consume much larger amounts of vitamin D, especially with the increasing popularity of vitamin D supplementation. Moreover, for those who are less exposed to sunlight, they tend to consume vitamin D supplements without medical supervision. This is why it's crucial to carefully monitor vitamin D consumption and regularly check vitamin D levels in the body. If vitamin D levels in the blood are too high, the risk of calcium buildup in blood vessels will increase, and this is very dangerous for our heart and brain. These vitamin D level checks can be done through a blood test, which will tell you whether your body is receiving enough vitamin D or consuming it excessively. So, while vitamin D is very beneficial for maintaining bone health, strengthening the immune system, and preventing osteoporosis, we must always be careful with its dosage. Don't let the intention of maintaining health end up with an unexpected stroke or heart disease. Consult a doctor before deciding to consume vitamin D supplements, especially if you have a history of heart disease or blood vessel problems. Additionally, you also need to understand the symptoms of excessive vitamin D to watch out for, such as excessive fatigue, bone or joint pain, nausea and vomiting, and increased thirst and frequent urination. If you experience these symptoms after consuming vitamin D, contact a doctor immediately for further examination. Don't wait until the symptoms worsen. Vitamin D is a good friend, but only if consumed wisely. By knowing the dangers of excessive vitamin D, you can protect yourself from the risk of a sudden stroke that can occur without warning. Remember, balance is key to maintaining our body's health. Don't let small mistakes in vitamin consumption ruin your long-term health. The dangers of vitamin E, why you must be careful. Have you ever heard of vitamin E as a supplement to brighten skin or maintain heart health? If so, you probably also know that vitamin E is a very beneficial antioxidant for the body, often used to fight free radicals that can damage body cells. However, did you know that excessive vitamin E can actually cause fatal damage to the body, including increasing the risk of sudden stroke? Vitamin E is a fat-soluble vitamin, which means our body stores it in fat cells and uses it as needed. As an antioxidant, vitamin E acts by reducing oxidative stress in the body and protecting body cells from damage by free radicals. Many people consider it a safe and beneficial supplement, especially since it is widely used to maintain skin health and improve heart health. However, there's a dark side to vitamin E that is often overlooked. Excessive consumption can be harmful and even fatal. Why is that? When our body consumes vitamin E in very high doses, this supplement can interfere with the blood clotting process, which is vital for our body. One of the main functions of blood clotting is to prevent us from bleeding too long when injured. If blood clotting is disrupted, the risk of excessive bleeding increases, which is very dangerous, especially when it occurs in the brain. Hemorrhagic stroke, a type of stroke caused by bleeding in the brain, is one of the side effects that can arise from excessive vitamin E consumption. This type of stroke occurs when blood vessels in the brain rupture and cause blood to flow into areas of the brain where there should be no blood. This brain bleed can be very dangerous, as brain damage can occur very quickly. In some cases, hemorrhagic stroke can even be fatal if not treated promptly. Now you must be wondering how much vitamin E can cause problems. The safe limit for vitamin E consumption recommended by health experts is around 15 milligrams per day. However, many people consume much larger amounts of vitamin E supplements, sometimes reaching 400 milligrams per day or more. This excessive vitamin E in high doses can disrupt the body's ability to clot blood, thereby increasing the risk of uncontrolled bleeding. Vitamin E also interacts with blood thinners like warfarin, which are often used for patients with a history of heart disease or stroke. If someone consumes vitamin E supplements along with blood thinners, the side effects can be very dangerous. The increased risk of brain bleeding and stroke is very high in this condition because vitamin E can worsen the effects of blood thinners and make it difficult for the body to stop bleeding when trauma occurs. However, what's even more surprising is that many people don't realize they are consuming excessive doses of vitamin E. This often happens because many supplements contain hidden vitamin E in products like multivitamins, beauty supplements, and even creams or lotions that claim to improve skin health. Unknowingly, they are already consuming more than the recommended dose, which can lead to serious health risks. Even if you don't directly consume vitamin E supplements, some foods also contain relatively high amounts of vitamin E, such as vegetable oils, nuts, seeds, and green leafy vegetables. While these natural food sources are indeed healthy, their consumption must be in balanced amounts. If you consume too many foods rich in vitamin E without proper supervision, you risk developing an excess of the vitamin, which can ultimately affect your body's ability to regulate blood clotting. Regarding the use of high-dose vitamin E, it is very important to stop using this supplement without doctor consultation if you start experiencing certain symptoms. Symptoms that can arise from excessive vitamin E include nausea, vomiting, increased thirst, or even longer bleeding when injured. If you feel any suspicious symptoms after consuming vitamin E, consult a doctor immediately. So, how can we safely consume vitamin E? The first step is to always check the label on every supplement you consume and ensure the dosage is appropriate for your body's needs. Don't be tempted by exaggerated claims that vitamin E can cure or improve various health problems with just large doses. If you feel you need to consume more vitamin E than the standard dose, make sure to consult a doctor or nutritionist first. They will help guide you to get optimal benefits without posing health risks. If you have a history of blood clotting problems, heart disease, or other issues affecting blood vessel health, don't hesitate to get regular checkups. Managing your diet, avoiding high doses of vitamin E supplementation, and maintaining a healthy lifestyle are the best ways to protect your body from the potential dangers of sudden stroke. Don't let the vitamins you consume become a threat. With a deeper understanding of the benefits and dangers of vitamin E, you can be more careful in managing your supplement and vitamin intake to ensure safer long-term health. The dangers of B vitamins. Imbalance that can cause stroke. Did you know that some vitamins from the B vitamin family, often considered helpers for brain health and body energy, can be a hidden threat to our health, especially stroke? B vitamins indeed have many benefits for the body, such as supporting brain function, energy metabolism, and the nervous system. However, excess or imbalance in consuming B vitamins can cause very dangerous effects. Let's discuss in more detail how excessive B vitamins can risk causing a sudden stroke. B vitamins consist of a group of complex vitamins, including B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folic acid, and B12 cobalamin. Each of these vitamins plays an important role in body metabolism, energy production, and supporting nerve and brain function. However, although these vitamins are very important, excessive consumption can cause an imbalance that has a negative impact on the body, including increasing the risk of stroke. Let's start by looking at vitamin B6 and vitamin B12, two vitamins from the B group that are often used to increase energy, especially in those who feel tired or lack stamina. Vitamin B6 plays an important role in protein metabolism, brain function, and even helps maintain hormone balance. Vitamin B12 is also very important for red blood cell health, as well as supporting nervous system function and DNA production. However, although both are very beneficial, excessive consumption of these vitamins can cause serious side effects. Excessive vitamin B6 can lead to nerve damage, known as peripheral neuropathy. If you consume vitamin B6 in very high doses, it can cause damage to peripheral nerves, leading to symptoms such as tingling, muscle weakness, and very disturbing pain. Not only that, in the long term, excessive vitamin B6 can also cause impaired body coordination, potentially increasing the risk of falls or accidents. This disorder may not directly appear as a stroke trigger, but it can worsen existing body conditions, such as heart problems, which ultimately increases the risk of heart attack or stroke. In addition, excessive vitamin B12 can also affect homocysteine balance in our body. Homocysteine is an amino acid that plays an important role in metabolism, but if its levels are too high in the blood, it can damage blood vessels and cause an increased risk of stroke. Vitamin B12 actually helps lower homocysteine levels in the body, but excessive consumption of this vitamin can disrupt homocysteine metabolism, which actually increases the risk of blood vessel damage and ischemic stroke. But what may be more surprising is vitamin B9, or more commonly known as folic acid. Folic acid is known as an important vitamin for pregnancy and red blood cell production, but if consumed too much, folic acid can cause disturbances in homocysteine metabolism, which indirectly increases the risk of blood clots and stroke. Many people consume folic acid supplements without knowing that high doses of folic acid can be dangerous if not balanced with enough vitamin B12. Without proper balance, excessive folic acid consumption can actually worsen the increase in homocysteine levels, which can cause blood clotting problems. Furthermore, vitamin B3, niacin, is also often considered safe, but if consumed in very high amounts, niacin can cause an increase in blood sugar levels leading to diabetes. Diabetes itself is a major risk factor for stroke because it can cause damage to blood vessels and increased blood pressure. For example, many people consume niacin to lower cholesterol levels or improve heart health, but excessive doses of niacin can actually cause an increase in blood sugar, which worsens diabetes complications and increases the risk of stroke. What's interesting is that many people assume that B-complex vitamins are a quick solution to maintain energy and body health. However, they often overlook the fact that excessive B vitamins, especially if consumed in high doses or without medical supervision, can trigger serious side effects, including stroke and an increased risk of heart disease. So, how can we avoid this risk? The first is to understand the correct dosage for each type of B vitamin. Consuming B-complex vitamins in doses recommended by a doctor or nutritionist is very important to ensure we get optimal benefits without causing dangerous side effects. Don't be tempted to consume large amounts of B vitamins just because of claims that these supplements can increase energy or support brain health. Remember, more is not always better, and excessive B vitamins can actually cause serious disruptions in the body. In addition, always make sure to consult a doctor or nutritionist before consuming B vitamin supplements, especially if you have certain medical conditions, such as heart disease, diabetes, or blood clotting disorders. B vitamins are very important for our body, but excessive consumption can disrupt body balance and cause unexpected dangers. By knowing the risks and benefits of each type of B vitamin, we can be wiser in managing B vitamin consumption. A good understanding of the correct dosage will help us get the maximum benefits from B vitamins without posing serious health risks. So, if you want to keep your body healthy, make sure you understand your body's B vitamin needs and always follow medical instructions. What you must do to prevent vitamin-related stroke. After knowing how dangerous excessive vitamins we consume can be, the next step is to understand what we can do to prevent the risk of stroke that can arise from excessive vitamins. In reality, many people consume supplements or vitamins with good intentions to maintain their health, but without realizing that excessive consumption can cause very detrimental effects, including increasing the risk of sudden stroke. So, how can we prevent this risk? What do we need to do to keep our bodies healthy, balanced, and free from potential dangers that come from uncontrolled vitamin consumption? 1. Consult a doctor or nutritionist before taking supplements. The first thing we must do to prevent vitamin-related stroke is to consult with a medical professional, especially if you plan to take supplements or vitamins in high doses. A doctor or nutritionist is the best source of information who can help us understand the right dosage according to our body's needs. Many people take vitamin supplements without supervision, assuming that more is better. In fact, this is a big mistake. Everyone has different needs, depending on age, gender, lifestyle, and certain medical conditions. Therefore, before you start taking vitamin supplements, make sure to get a health checkup to find out your body's condition and determine what vitamins you need. 2. Understand the correct dosage and do not exceed safe limits. After consulting a doctor or nutritionist, the next thing you must do is ensure that you consume vitamins in the correct dosage. Excessive high doses of vitamins can carry significant risks for the body, such as stroke, blood clotting disorders, and various other health problems. For example, vitamin D, which is very beneficial for bone health and immunity, has a maximum safe dose of 4,000 IU per day for adults. Consuming more than the recommended dose can increase blood vessel calcification, which risks causing a stroke. The same goes for vitamin E and vitamin K. Although both are important for our body, excessive consumption can interfere with the blood clotting process and worsen heart disease. Don't be tempted by exaggerated claims about the benefits of vitamins in large doses. More is not always better. Instead, focus on balance. Too little vitamin can cause nutrient deficiencies, but too much can also trigger bigger health problems. Understand the safe limits of vitamin consumption according to medical instructions. 3. Choose natural vitamin sources. The next step in preventing stroke caused by excessive vitamins is to prioritize natural sources for getting vitamins, rather than relying on supplements. The vitamins we consume should come from natural foods such as fruits, vegetables, grains, and healthy proteins. Consuming foods rich in natural vitamins is much safer and more beneficial for the body than relying on supplementation. For example, to get vitamin D, we can sunbathe in the morning sun, which is rich in natural vitamin D. For vitamin C, we can eat citrus fruits like oranges or lemons, which contain high antioxidants and help maintain skin health and immunity. By choosing natural sources, we not only get complete nutrients that are easily absorbed by the body, but also avoid excessive doses that often occur with supplements. A healthy diet rich in whole and varied foods will provide us with the vitamins and minerals needed without risking side effects. 4. Pay attention to vitamin interactions with medications you are taking. Often, we don't realize that the vitamins we consume can interact with the medications we are taking. Vitamin interactions with drugs can worsen side effects or even cause unexpected health problems. For example, vitamin K can interfere with the action of blood thinners like warfarin, while vitamin E can increase the risk of bleeding if used together with drugs that affect blood clotting. If you are undergoing treatment for a specific medical condition, always inform your doctor about the supplements or vitamins you are taking. This is very important so that the doctor can provide proper guidance on safe dosages or even advise avoiding certain supplements that could be risky for your health. 5. Maintain an overall healthy lifestyle. In addition to paying attention to vitamin dosages, one of the best ways to prevent stroke and other health problems is to maintain an overall healthy lifestyle. Vitamins and supplements will only provide benefits if they are consumed within the context of a healthy lifestyle that includes a balanced diet, regular exercise, sufficient sleep, and good stress management. A healthy and nutritious diet will provide your body with all the vitamins it needs without having to rely on supplements. Regular exercise is also very important for maintaining heart health and preventing stroke. Exercises like walking, cycling, or swimming help maintain smooth blood circulation and strengthen heart muscles. In addition, exercise also helps lower blood pressure and maintain a healthy weight, both of which are very important in preventing stroke. Sufficient sleep and stress management also play a big role in maintaining long-term health. Poor sleep quality and chronic stress are risk factors that can worsen blood vessel conditions and increase the likelihood of stroke. Taking time for relaxation, meditation, or enjoyable activities with family can also help relieve excessive stress. 6. Conduct routine health checkups. Finally, routine health checkups are a step that should not be missed to find out your overall health condition. These examinations are important for monitoring vitamin levels in the body, as well as for detecting health problems early, including blood sugar, cholesterol, or high blood pressure problems, all of which are directly related to the risk of stroke. By undergoing regular checkups, we can ensure that our body is in optimal condition, and we can immediately take necessary actions if there are any problems. This also gives us the opportunity to improve our diet or adjust vitamin consumption according to the body's actual needs. So, what can we do to prevent vitamin-related stroke? The first step is to consume supplements wisely. Always consult a doctor or nutritionist and pay attention to the correct dosage. Choose natural vitamin sources, avoid interactions with medications you are taking, and make sure you live an overall healthy lifestyle. That way, you can reduce the risk of sudden stroke and ensure better long-term health. Don't be too late. If you are concerned about your supplement or vitamin intake, consult a doctor immediately. Prevention is better than cure, and our body only has one chance to stay healthy. Don't underestimate the signs your body gives you. Take care of your health now for a better future. Thank you for watching this video. Don't forget to like, comment, and share if you found this information useful. Feel free to subscribe so you can continue to get other important and interesting information. May you always be given health and happiness. See you in the next video. And remember, health is the most precious treasure